Chapter 1: The Era of Hydrotherapy. Imagine a world where mental illness is treated with water, insulin, and even electricity. Does it sound surreal? Perhaps even a bit terrifying? Yet, these are real treatments that psychiatry has employed throughout history. Our journey begins in the late 18th century, with the advent of hydrotherapy. This involved the use of water, either hot or cold, to calm patients and alleviate their symptoms. Some individuals were submerged in baths for hours. Others were wrapped in icy sheets. And some were even bombarded with powerful jets of water. The theory was simple: by changing the patient's physical condition, their mental state would also improve. Despite its seemingly gentle approach, hydrotherapy was often a deeply distressing experience for those subjected to it. Chapter 2: The Rise of Insulin Shock Therapy. Next, let's move forward to the 1920s, where a treatment known as insulin shock therapy emerged. This technique involved inducing a coma in the patient by injecting them with large doses of insulin. The theory was that the coma would reset the brain, much like rebooting a computer. The practice was not without risks. Hypoglycemia, a condition caused by low blood sugar, was a common side effect and could lead to seizures, heart failure, and even death. Despite these dangers, insulin shock therapy was a widely accepted treatment for schizophrenia and other mental illnesses until the 1950s. Chapter 3: The Era of Lobotomies. From there, the path of psychiatric treatments took a sharp and chilling turn in the form of lobotomies. Originating in the 1930s, this invasive procedure involved severing connections in the brain's prefrontal cortex. The intention was to alter the patient's behavior and provide relief from mental illness. However, the results were often catastrophic, leading to personality changes, cognitive impairment, and in some cases, death. By the late 1950s, the lobotomy had largely fallen out of favor due to its devastating side effects and the development of effective antipsychotic medications. Chapter 4: The Evolution of Electroconvulsive Therapy. Finally, we arrive at electroconvulsive therapy, or ECT. Introduced in the 1930s, this treatment involves passing an electric current through the brain to induce a seizure. The idea was that these induced seizures would somehow reset the brain and alleviate symptoms of mental illness. Unlike the previous treatments, ECT is still used today, albeit in a much more controlled and humane manner. Modern ECT uses anesthesia and muscle relaxants to minimize discomfort and side effects, and it remains an effective treatment for severe depression that does not respond to other interventions. Chapter 5: Reflections on the History of Psychiatric Treatments. So, what have we learned from this journey through the history of psychiatric treatments? First, the human mind remains one of the greatest mysteries in the universe, and our attempts to treat its ailments have been, at times, misguided and even brutal. Second, the path to understanding and treating mental illness is a winding one, filled with triumphs and tragedies. Lastly, it is a stark reminder of the importance of ethical considerations in medical research and treatment. From the icy waters of hydrotherapy to the shocking currents of ECT, the history of psychiatric treatments is a testament to our relentless pursuit of understanding the human mind. It's a tale of resilience, innovation, and the enduring hope for a future where mental illness is treated with the care, respect, and dignity it deserves.